You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Sean Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Super excited to have today's guest on the show. We spent a bunch of time together in Portugal. They were my personal Portuguese tour guides. So, Ivan, go ahead and get us started.
I'm very excited to see our guest today here. I also met him at the conference in Portugal, which was, again, fantastic. You have a beautiful country, awesome food, beautiful sunsets, and I can't say enough nice things about Portugal, but this is going to be a challenge for me pronouncing your name. So I'm going to try this. So we have Guilherme Coelho.
That's perfect. That's perfect.
All right, good. So, so we're today to talk to. Now I'm going to switch to just calling you G because that's just easier. So we're gonna talk to G, who is co-founder and CEO of Maven. He doesn't know what his life is without pets. That's why he's building the first AI plus human vet that knows if your pet is safe and healthy 24/7. So, G, tell us about your product. What are you building? What are you trying to achieve?
Yeah. First of all, thank you for having me, Sean and Ivan. I hope you enjoy Portugal. Okay. I hope you come back. It's always a struggle for me when I go to the US. I have to leave my country. But yeah, telling you a little bit about maven.pet. And as you mentioned, Ivan, I grew up with pets. I don't know what life is without pets, and I felt personally how bad it is when we just realize too late when something is wrong with our pets, right? So pets are new family members. We do everything we can for pets, but the thing is that everything out there is still reactive, right? So as pet owners, we don't realize early when something is wrong. And so the goal with Maven is really to build a system that can, through data, understand early on when there's something wrong with a pet, okay? Any pet, a healthy pet, a pet with some sort of chronic condition, and let the veterinarian know early on that something is wrong with that pet so that we can tackle problems on day one.
So, G, sounds very interesting. What does it look like? So we're an audio only podcast for now. Maybe we're going to have video someday. But help our listeners understand what is Maven.
Yeah. So Maven is really like this AI vet that digests data from different sources. Okay, so we do have a smart collar, we do have a mobile app. We are currently integrating with other PMS systems out there, and so there's two different kind of experience, right? The veterinarian will receive an alert when there's something wrong with one of their patients, and at the same time, what the pet owner sees and get, it's a smart collar to monitor the pet's behavior 24/7, respiratory rate at resting, and have an understanding through the mobile app if something how their pet is doing. How their pet is doing throughout the day, throughout the night. They can also let their vet know if there's some relevant events such as vomiting, diarrhea, things like that. And so what we built at Maven is really this system capable of digests dozens of data points from different sources and pinpoint early when something is wrong with our pets.
So walk me through it a little bit more. So I understand that this is a monitoring system. There's a caller that you guys
Yeah.
also have, and then for the vet, what is sort of the user story or user journey? How do they get alerted, and how can they use it in their day-to-day life? What would be the application of this? Is this just an alert that they can monitor? Would this be a reception that sees there's an alert? We need to contact this client. Like, what does it look like for the vet practices? If that's your core customer, or is your core customer is a pet owner, and then given what they see based on this data, then they contact the veterinarian?
So that's a great question. We work directly with the clinics, okay, with the doctors at the practices, and their experience is as seamless as possible. Okay, so we all know vets are super busy, and there's a shortage of staff within the industry. So how we've built things is that the veterinarian or actually anyone within a practice can see value from our product super fast. Okay, so they will receive an alert either through email or through the PMS system they are currently using, telling them when there's something wrong with their patient and what is exactly wrong. Okay, so for example, if a diabetic pet suddenly starts getting lethargic, throwing up, and reporting high opacity, that will trigger an alert, and the veterinarian or anyone within the staff team, it really depends on practice to practice, will receive that alert. Or if they are monitoring a post-surgery patient, or if they are monitoring a patient with cardiac problems, if there are relevant changes within the pet, okay, the veterinarian will receive an alert, and like in 10 seconds will understand what's wrong with that pet, okay, so that they can follow up as they see fit. Either call them through a phone call, ask them back at the clinic so they can reassess treatment. That's part of the clinic business. Our goal at Maven is really empower veterinarians and empower the staff at the clinic with data that supports that something is wrong with pets early on, so they can tackle that as soon as possible.
And so I'm guessing the reason, you guys want to do this is to really extend that care continuum past the walls of the clinic. So help me help me prove out my hypothesis. So I take my dog in for surgery, and the veterinarian tells me that my dog shouldn't be running around. And I'm going to put the collar on the dog, the Maven collar, and I get my dog home and I make sure that the dog's not running around. And then I leave the house, and my neighbor comes over to water the plants and lets the dog out in the backyard, and it's running around like crazy. I'm guessing at that point, the smart collar is going to talk to the software. The software is going to tell the clinic, hey, what are you doing? I told you not to have the dog run around. Am I barking up the right tree?
That's perfect, Sean. Yeah, that's one of our use cases. It's like the moment we know for these specific pets under these specific clinical conditions, if something is wrong, that will trigger an alert and send that information back to the clinic. Okay, so our system knows if this is a diabetic pet, or a pet with cardiac problems, or if it's a healthy pet, or just a senior giant breed that most likely will start to developing some OA issues. And so we've built that into the system, and then it's capable to let the veterinarian know early on if something is wrong with one of their patients, so they can tackle that as soon as possible.
So I'm just wondering what kind of feedback you're getting from your pet owner customers, because, for example, I threw my back. I can't do weights anymore, and my doctor told me, he's like, you can't do squats anymore. And what I do, I take ibuprofen so it doesn't hurt anymore, and I do squats. So, and if my doctor would get an alert and be like, "Hey, Ivan, I told you not to do that," I'll be a little freaking out about it. I'd be like, "Well, I knew I was doing wrong, but I didn't want you to know about it." So, what kind of like doesn't it put the pet owner a little bit into this accountability circle where they could be a little scared that there's a monitoring behind it, or are they actually all super happy and they're like, no, this is amazing? What do you get as feedback from your pet owners, customers?
Yeah, I think we all agree. That's a great question, and actually we got that question a couple of times. But the thing is that it's overwhelming being a pet owner, right? We have pets don't talk. We have no idea what's going on, if they are in pain, if something is hurting, if the exercise is enough, if they are sleeping well or not. And so with Maven, what the feedback that we have from pet owners is that now they have peace of mind of knowing that their vet is keeping an eye on their pet 24/7. Now they know that if something is wrong with their pet, Dr. Ivan will know about it, and they can act upon that. That's like the peace of mind that pet owners have been waiting forever. Okay, and when they get it, when it clicks, when they realize, oh wait, my vet is actually making sure nothing is wrong with my pet, and if there is, they'll know right away. That's peace of mind. So the burden that also comes with being a pet owner and going home with a bunch of guidelines to follow, a respiratory rate to monitor, things like that, disappears. It's the feedback that you have from pet owners is that they don't want to go back. The moment they feel this, they don't want to go back.
Yeah, it's like you're giving the pet a voice where they don't have one, which is really, really cool. The one thing that just popped into my head is, well, what an incredible device to pair up with wellness plans, right? So instead of just the wellness plan, you now have this activity tracking, you have all of this other information that the vet is able to kind of like bring to that very short visit to kind of enhance the quality of the visit. So I don't know that was a question. I don't think it was. It was just a thought that I couldn't help but say. But I do have another question, which is, what makes Maven?
Control
I
yourself, Sean.
can't. You should stop doing squats and taking ibuprofen, but that's another episode. So the other question that I had is, what makes you different from all of the other pet trackers that we've seen before? I mean, I get the AI element and the reporting back to the vet. I think that's really cool. But, there's been many other pet trackers. Lots of our friends have started companies doing that in the space. But what sets you guys apart?
Yeah, I'm glad you asked that, Sean. And actually, I've been on the wearable space for 80 years now. Okay, so I do feel, and the wearable is just a piece of Maven. Okay, it's just one of the ways where we collect data. Okay, so we collect data on the mobile app. There's Maven Journal. There's these virtual checkups. So our AI system is dynamically asking questions to the pet owner. So the goal is really to leverage data so you can go down the funnel and understand early on if something is wrong with a pet. Okay, because a pet being lethargic or a pet being restless could mean all sorts of things. And that's different if we are talking about an allergic pet or a senior pet or a pet with diabetes, right? And so the wearable is just a piece of it. Everything else, all the other features, all these AI system that's dynamically digesting data from sources and asking follow-up questions, it's what's really different. Okay, and so we, by working closely with veterinarians, we are bringing meaning to the data. We don't measure how many calories the pet burned or how many miles or how many walks. Okay, we detect for abnormal changes through the hardware and what that might mean for this pet profile based on information that we have from Covetrus or Digital or other softwares based on follow-up questions. Like that's really the secret sauce of Maven, is really bundling all these data sources that allow us to understand early if something is wrong.
Very, very cool.
So with the veterinary clinics, one of the hardest thing when you're a customer you sell to is the veterinary clinic, is implementation.
Yeah.
How do you see it incorporate into the day-to-day workflow? Because vets, as you said, they're busy, and then getting extra information. I can see how what you're creating is actually like it's almost like a lead generation. So if you'll speak in marketing language, it's generating a customer that has a need or should have a need based on the data that you're receiving. So it's almost like in marketing, you always think, or in sales, you're always thinking, what could be the next reason to contact the customer?
Yep.
Write a white paper, produce a blog post and get their attention. So in this case, if I compare it, marketing to marketing, I'm thinking, okay, well, there is a health reason for veterinarian to be proactive and say, hey, I would like to talk to you or see you because your pet is running around. And then we said that we've done TPLO and you shouldn't be running around. So therefore, let's come back to the hospital and generate that lead. That's how I kind of pragmatically see it. But then on a day-to-day operations, who is checking that, those alerts? Who is making the call? And what is the sort of call to action for veterinarian? And how does it work in their day-to-day operations?
Yeah. So that really depends also from practice to practice, right? So we work with 3-4 DVM practices, and we work with other bigger corporate with several facilities. Okay. And so it really depends. Okay. So some of our patients are very close to the doctor. Okay. And so the doctor is the one that wants to be receiving these alerts. But at the same time, we've built these alerts in a way that anyone within the industry, it doesn't need to be the doctor, can understand those and can act on those. Okay, and so that's really up to our client, to the practice, to understand how they want to fit Maven within their workflow. Okay, because they have different workflows, they are used to different processes and things like that. So our goal is really to empower the staff with data so they can be better at their job, so they can enhance the quality of their care, so they can build higher satisfaction, higher retention with their customers. And obviously, there's also financial upside to the clinic because now they have like a billing recurring with their clients. And so we touch different areas that practices are struggling in, right? And I hear this a lot on your podcast. There's a financial pressure. There's the shortage pressure that they want to do more with less. And so I really feel Maven touches these different points and struggles that the industry is facing today.
So what is the big dream? Let's say you're 5 years from now, and you achieved your big goal with this product. What does that look like? What does that big dream look like? Tell us about that.
Yeah, I dream with that a lot. Okay, so I've been working on this industry for, as I mentioned, 8 years now, and I'm a huge believer that data and technology can really change how today we take care of our pets. Okay, because the way I take care of my pets, it's the same way my parents do. It's the same way my grandparents did. Okay, and so it's still based on assumptions. It's still based on perception. 80% of the job of a veterinarian is still asking the right questions and interpreting answers. And so I do feel data can have a crucial impact on how we take care of pets. Okay, so like in 5 years, I do expect that all surgeries go home with Maven, and we have a much lesser presence of post-surgery complications. All patients with cardiac problems go home with Maven, and we can understand nuances on respiratory rate and let the vet know immediately. All chronic patients go home with Maven, and we can make sure treatment is effective. Okay, and we don't need to wait from the 6 months follow-up to understand if the pet is improving or not. And all healthy pets go home with Maven because pets are family members, right? They are sleeping on our beds. If I go home late and my pet is with my girlfriend at the bed, I'll sleep on the couch. That's the kind of social like position for pets today. And so I do feel like with data, with solutions like Maven, where we leverage like data points from different sources to understand early if something is wrong, can impact the whole industry. Not only the hospitals and the practices, but how new products are developed, right? So like drug manufacturer, even pet food manufacturer, we could leverage data to understand if different products are being effective or not.
Yeah, it's super fascinating. I think there's many, many angles that you could
Oh yeah.
chase down. So let's talk about practicality. So today, you've built the hardware; it exists. You've built the platform. You're already in existing users. What does an ideal customer look like to you? And what's the easiest way for people that are in our audience around the world to get started with Maven? And why should they?
Yeah. So we onboard clinics every single week. So everything is obviously ready. We have like dozens of clients already in the United States, some on Canada, and Australia as well. And so it's as easy as reach out to me directly at g@maven.pet or go to our website maven.pet and book a demo and see if this is for you. Okay, so our ideal customer are these like clinics that really prioritize the quality of care. They want to have a close relationship with their pets, with their patients, and obviously the pet owner. And so those are our ideal customers. But at the end of the day, any clinic, any practice, any hospital can leverage our solution.
That's amazing. So when we started the episode, we had chatted about maybe doing a giveaway. So you've got a care kit to get veterinary clinics started. Why don't you talk to us a little bit about what that is, and then why don't we give one away?
Yeah, so we do have a starting bundle valued like $500, where practice would get 3 kits, 3 free seats on the hardware. We would build a branded website, a branded literature for the front desk. We'd also send a display kit, and I'm excited to give one of those away.
So I think what we should do is probably just get anybody that's interested to send you an email.
Yeah.
Maybe spell it out phonetically. And if you're interested, you want to get started with Maven. I think the reason that they would want to get started with Maven is to enhance the quality of care, but I think there's also a financial component for any individual practice as well, correct?
Yeah, correct. So we do have a use case of one of our oldest clients, which is for DVM practice, where they started introducing Maven to their patients, and they are on track to increase their annual revenue by $500,000. Okay, so there's also a massive financial upside for clinics that started working with us. So it's not only financial, it's not only increase the quality of care, it's not only differentiation, it's not only saving time, so they can focus on things that really matter. So all of that. The feedback that we have is different touch points that Maven can help on.
So, if people are interested in getting one of these free kits that's valued at $500 USD to give Maven a try and to help their pet parents, how do they get a hold of you?
Yeah, just send me an email, g@maven.pet, so g@maven.pet. And our website, as simple as that, maven.pet as well. So it's a catchy name.
Nice. We'll pick one random listener and get you guys a kit shipped. And I think with that, we've kind of chewed through all of our time, as we always do. So we got a couple questions to wrap things up here with you. First one is a book, a YouTube video, a TED Talk, something that you found inspiring on your career so far that you'd like to share with our listeners.
Yeah, so not sure if this has already been shared here or not, but as an innovator myself and then trying to bring something new to the industry, Crossing the Chasm is a book that I always refer to, and it helps understanding like who are going to be our first early adopters and how we should position, and then how you scale from like 10 to 100, 100 to 500, 500 to like 10,000. And so it's really a book that I love and that has been super helpful for us as we scale Maven.
And the second question that we have is there another innovator that you would like to invite to this podcast?
A lot of the innovators out there have been here, okay, and so it was a hard job to get someone, but I think the guys at Malum.ai, so they start developing a non-invasive thermometer for pets, and they are really on the business of getting more products out there that help on this remote monitoring aspect of the industry. And so either Ben or any of the co-founders would be a great match for your podcast.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.